The title of my project is Regression Analysis of COVID-19 Vaccine Side Effects. And so the journal article that I chose for the main focus of my project was actually this article. And so this article had actually 840 responses from healthcare workers, and these healthcare workers were given the Sinovac COVID-19 vaccine, and then the recipients recorded whatever their side effects might have been. And this was really categorized by gender and age group, and also their jobs, their actual positions in the hospital. And so for my project, I had students divide the age groups into greater than 50 years of age and less than 50 years of age. And so I'll come back to that. Since the primary goal of my project was to get them to understand more about statistics and regression analysis and creating graphs, I broke this into several different steps. And so my class consisted of entirely clinical laboratory science majors, and they're all juniors beginning their professional phase. And so most of the students, I guess basically all the students had to have a statistics course of some kind when coming into this program. So all of them had some idea about statistics, but most of them had not done regression analysis or studied the meanings of the regression in this way. So 72% of my class was female, 28% male, 11% identified as white, 6% Hispanic, 72% African American, and 11% Asian and Pacific Islander. So instead of just throwing at them the major concept of regression analysis, I broke it into baby steps. And so I gave them this strictly hypothetical, very simple data set, and I showed them in class how to do regression analysis, as well as how to form a graph using Excel and how to choose the best fit formula. And so again, this was all demonstrated carefully in class. Asked them if they had questions, and then I let them know what they would really be doing for the main parts of the project. And so after that, I made sure to show them a video demonstrating how to create a best fit formula, how to create a graph. And in addition to the video, I wrote step-by-step instructions on how to do this to make it as simple to them as possible, because I didn't want them to be afraid of the math, because a lot of people do seem to sort of be afraid of math, especially who aren't in the major. And so along with the video, I showed them how to perform a regression analysis, which was in the video, and I gave them step-by-step instructions. If they didn't get that themselves out of the video, they could just follow my instructions. There were some people who didn't have the capability on their Excel to do regression, so I had to show them how to enable that. And a few people who their computer wouldn't enable in that way, then we just went to the computer lab to do that, because the computers in the computer lab did have Excel and were able to have that that software pack added to it. So that was important to have them prepared in advance to be able to do this project. So I also had listed the meaning of each of the parts that the regression analysis gave, so they wouldn't be overwhelmed trying to figure this out. Made it pretty simple and straightforward, even though all of this is not necessarily simple and straightforward. I wanted to keep it as simple as possible, again, so that they would welcome learning this. I gave them an initial assignment in addition to the simple data that I showed them in class. I I gave one set of data to the entire class, but each person had to turn in their results. So each person had to show me that they individually created a graph, made a best fit formula, that they were able to come up with the regression analysis. And so that was pretty successful because I saw students working together. And again, this was early on in their program with us. So seeing that they were, starting to learn to work together and help one another was very good. And I feel like that kept them working together throughout this academic year. There were a few people that came to me directly for help. And then I noticed some of those people were helping other people later. So it was really a neat thing to see. In addition to showing me that they could create their regression analysis, each student had to turn in a sheet explaining their interpretations of the regression. And as simple as possible, because I think keeping this very simple helped them understand it better. And, if they want to add to this learning later, they can, but what they gained from this is really helpful. I think one of the neatest things about this initial assignment was that I had them, as you can see in number 8, I had them to choose an X value that was in the range of their data. And then from that X value, they determined the Y value from that formula. And then they could see it, they could even plot that on the graph and see that it is predictable that this graph that they created from this data could be used to help predict, what the Y value would be from X's in that range. So that was really neat. I think it helped them build confidence in this process. So the initial assignment was worth about 10% of their grade, and the main assignment that had to do with this article was worth about 90% of their grade. And so as you see, there are lots of symptoms listed here: swelling, redness, itching, fever, headache, and so forth. And most of the side effects did not correlate as far as age, meaning that the ones older than 50 or less than 50 didn't necessarily have more or less of the side effect than the other group. So they weren't really seeing a lot of correlations. And so I had one person draw out of the hat when we drew symptoms. Someone drew a hypothetical symptom, which I put in there. And that way I made up the data and showed them what it would look like if there was a near perfect correlation. And so this is an example, or actually this is the data set, which is one reason I chose this journal, is because these authors actually provided their original Excel data, which I thought was really cool. And you can see that it's categorized by gender, age group. So the students had to change the greater than 50s to 1s and the less than 50s to 0s. And then for their symptoms, they had to do the same: 0s for no's, 1s for yeses, and then perform the graph and regression analysis. So out of 840 responses, this is on the left, one of the students who did age versus the symptom breathlessness, and you can kind of tell there's not much of a correlation. And on the right is the hypothetical one that I just made up to indicate to them that this is what it would look like if it was closer to perfect correlation. And so when the students presented these to one another, they paid close attention and noticed the difference. And then this is an example of one of the student regression analyses and the interpretation on the right of how they saw that as they could, extrapolate meaning from that regression analysis, what their understanding was. And so during these presentations, everyone presented their graph, their regression, their interpretations. And with this, we also had a discussion about the importance of statistics in science, not just to take a news article for its word or even a journal article as whatever its title says. They learned to look at the data and actually understand that the data is important. Did the authors actually interpret their own data as the student would. Are there other ways to interpret it? It made them question and not just assume what they're told is always correct. And so I feel like this was very beneficial to them, especially going into the clinical laboratory science program where scientists really do need to understand to look deeper. So I appreciated this opportunity for myself to learn a little bit, to actually get to teach this topic, and for the students to really learn a lot more about what it means to look at the data. So thank you so much.